All right, everyone, we're going to get started. So good afternoon, welcome, and thank you for joining today's Lunch and Learn webinar, Cyber Liability Insurance, What Practices Need to Know About Risk, Selecting Coverage, and Avoiding Common Pitfalls. I want to start out by saying this webinar is being recorded, and the recording will be made available following the event. So my name is Justine Springer, and I'm a program manager at the Maryland Healthcare Commission, or MHCC, as we often go by. The MHCC is an independent regulatory agency whose mission is to plan for health system needs, promote informed decision-making, increase accountability, and improve access in a rapidly changing healthcare environment. One of MHCC's many priorities is raising awareness and sharing best practices about cybersecurity. I want to extend a sincere thanks to our event collaborator, MedCai, and please note that continuing medical education, or CME credit, is available for attending this webinar. As you can see, there's a full agenda for today's webinar, and we'll hear from two great speakers in just a moment who will share what practices can do to mitigate cyber risks, including key considerations when purchasing cyber liability insurance. So whether you have an existing policy or are looking to modify the type of coverage you already have, our presenters can help inform your decision-making. Before we get started, I have some brief housekeeping items to cover. During the webinar, it's appreciated if you could please keep your camera turned off and your line muted to avoid any unintentional background noise. There will be an opportunity to comment and ask questions during the Q&A portion of the event after the presentations. You can participate by entering your comments or questions in the chat function to the right of your screen, or you can also use the raise hand function, and I will call on you when it's the opportune time to unmute and speak. If you have any issues, please contact my colleagues Kelly Scott or Christine Karianopoulos for assistance. Their contact information was included in the email I sent on Thursday. The materials are available on MHCC's website. And in the event that there is any issue that caused me to have to end the Zoom webinar, I'll send an email with a new Zoom link. So here's some important information about the CME credit I mentioned and other disclosures for today's webinar. Our speakers and planners have no disclosures. In order to get the CME credit, you must complete a brief survey that will be sent following today's webinar. As we get started, I think it's important to first express sincere gratitude to all healthcare professionals and first responders that have been on the front lines of the COVID-19 pandemic. So thank you. With that said, these unprecedented times have heightened the likelihood of cyber attacks from bad actors who take advantage of shifts in people, processes, and technology. We all hear about data breaches in the news. When we look at healthcare, it's an industry that experiences a high volume of breaches compared to other sectors, according to a 2021 report by Risk-Based Security. And when you think about healthcare records compromised in a breach, it can be some of the most personal information there is about someone. But it's important to think about cybersecurity as a patient safety issue and how cybersecurity needs have to evolve to ensure patient safety is not impacted or mitigated to the greatest extent possible. Ransomware is one of the most common ways bad actors can cause disruption. So ransomware is malicious software designed to block access to a computer system until a sum of money is paid, and it's often launched through a phishing attack. Phishing relies on human error. You receive what appears to be a legitimate request asking you to click on a link, open a file, or provide sensitive information. Estimates indicate that over 90% of phishing attacks are done using email. So why does cybersecurity matter? Just a few years ago, 8 in 10 physicians were reporting some form of cyber attack. System downtime in healthcare can put patients at risk if physicians do not have all the information from a patient's chart that's needed for treatment. Hackers know this and target healthcare in hopes of getting substantial ransom to get systems back online. Even if a ransom is paid, there's no guarantee that the systems will be fully restored. It is essential for practices to take steps to mitigate the risk and impact of cyber attack. This includes cyber liability insurance to help with response and recovery. All healthcare organizations, small and large, must have good cybersecurity. It's often said that it's not a matter of if, it's a matter of when a cyber incident will happen. Cyber liability insurance is part of a well-rounded approach to manage and mitigate risk. Cyber liability insurance offsets costs associated with a breach and can help practices get the support they need to recover systems and patient data needed for care delivery. This is essential for practices to get up and running quickly to get back to what they do best, taking care of patients. So at this time, I'd like to introduce our first presenter today, Mr. David Grieber. Mr. Grieber will dive more into cyber threats and potential damage that may result, strategies to mitigate risk, and steps practices can take to prepare and minimize disruption to practice operations. Mr. Grieber is a principal at the law firm Offit Kerman, PA, where he advises clients on how to comply with federal and state privacy laws governing the collection, use, retention, disclosure, and destruction of personal information gathered from customers. He assists clients in establishing privacy and data security programs and drafts privacy policies and terms of use for websites and mobile apps, and has assisted clients in responding to data breaches. I will now turn it over to Mr. Grieber. You're still muted.
Good afternoon. I've been asked to speak on the subject of understanding and managing cyber threats, and I'll be speaking for about 20 minutes. Just a moment. Can you hear me now?
Yes, we can hear you.
Okay. I'll be speaking this afternoon on understanding and managing cyber threats, and thank you, Justine, for that introduction. My background and experience in privacy and data security includes certifications from the International Association of Privacy Professionals in privacy management, in US law, and in European law. I thought we would begin with some definitions of what we mean when we talk about data breaches and cyber incidents, and to review some of the consequences that Justine alluded to. From the standpoint of definitions, a cyber threat is really focused on the issue of data breaches, which in layman's terms are instances in which unauthorized people have access to regulated personal information. And in the case of healthcare providers, the focus is on protected health information. Data breaches include usually ransomware attacks in which information and computer systems are locked and held for ransom. I say usually because the presumption is that a ransomware attack enables the attacker to access the information. There are a series of analyses that need to be conducted, however, to determine whether it is in fact categorized as a reportable data breach. The consequence of cyber threats or data breaches can be significant. First, there is the out-of-pocket cost of analyzing and fixing the problem, usually through outside technical experts who isolate, contain, and eliminate the threat. They also assist forensically in determining the extent of the breach, and they cooperate with the legal team to determine what, if any, breach notifications need to be made to data subjects or to authorities. If data subjects need to be notified, then the cost can be significant. You need to give a notice that's appropriate to each data subject, and that notice is often mailed with the benefit of assistance from outside vendors. There is the exposure to regulatory fines from Health and Human Services if HIPAA violations are uncovered by the breach. And from time to time, there are also lawsuits by patients against their providers for lapses in the HIPAA privacy and security compliance. And finally, there is the loss of business reputation associated with having your data compromised. And some patients may decide that they want to go elsewhere. Of course, attacks are now so common that I'm not sure whether that would necessarily occur, but it is a consideration. In addition, there is the interruption in your normal business practice, reduced patient load as a result of inaccessibility to necessary patient records, distraction of your staff in dealing with the problem. So how do you quantify this threat? We know that doctors are scientists and quantitatively oriented. So in dollars, you might quantify the threat by multiplying the probability of a cyber attack by the cost or estimated cost of the cyber attack. When you do this, you get some pretty astonishing numbers. The healthcare industry is the main victim of data breaches because patient information has a resale value on the dark web that is in the hundreds of dollars per patient record. 76.59% of all data breaches involved healthcare service providers during the period 2015 through 2019. So you would have to categorize the probability of cyber attack as high. 255.18 million health records were exposed to hackers in the period 2010 through 2019, which is an astonishing number of records. And to make matters worse, hacking incidents are dramatically increasing in the healthcare industry. How much does it cost if you are subject to a cyber attack? Well, according to the study that is cited on your screen, published on the NIH website, the cost per record of a cyber attack is $529 per breached record using 2019 numbers. So that's 3 years ago. Healthcare has the highest cost per incident among any business sector in the United States. So if you take these numbers and do the math, and you assume that in your practice you have one doctor with a panel of 2,000 patients, which is not an unreasonable patient load, and you assume a cost per breach record is $500 just for the sake of the numbers being round, you get an astonishing and I think unbelievable number of $1 million for one doctor's patient's records being compromised. Now, that is an astonishing number, and frankly, I do find it difficult to believe, even though it's derived from a reputable study that gleaned the information from numerous reputable sources. But it's still an astonishing number. But even if you were to take half of that estimated cost per record and say $250 per compromised record, you still get a huge number, $500,000 in damage for that single doctor's records. In my experience in data breach incidents, you definitely are into costs that are in six figures if you have a breach of any size. The out-of-pocket cost to external experts. So if this potential loss is not survivable, then that makes risk mitigation that much more crucial for your practice. What can you do? Well, as Justine has mentioned, cyber insurance is a critical component of your risk mitigation strategy. I would recommend that you use or consider using a knowledgeable insurance broker to help you evaluate policies, because the coverages are not the same. The insured risks are subject to tailoring, and the costs vary depending on what you choose. So I would recommend that you get a knowledgeable insurance broker to give you a hand, and that you affirmatively engage in trying to understand the different kinds of coverage and making intelligent cost-benefit trade-offs. Secondly, for you to both prevent and mitigate data breach incident damage, you should conduct a comprehensive risk assessment. In that, I would also recommend that you use a knowledgeable consultant, because even though these analyses are required under HIPAA, and even though there are loads of tools and gobs of other information available to you on the HHS website at the location that I've stated on the screen, still walking through the process requires extensive preparation, analysis, and experience, and doing it for the first time by yourself is just impractical. Thirdly, I think as a general principle, and this is consistent with the way I understand doctors to practice medicine, you should prioritize addressing the most likely risks and devote your time and attention to triaging those risks and addressing them first. So to understand, what to triage, you need to know what the most likely risks are. And here they are. 92.59% of data breach incidents in the period 2015 through 2019 involved hacking or malicious attacks on your system, as opposed to two of the other common sources of breach that I've listed in this table: unintended disclosure and physical damage such as theft or loss of paper documents. Hacking or malicious attacks represent 92.59% of data breach incidents, which is astonishing. The focal point of the attacks is typically email, and phishing attacks is one common risk vector. The second most common source of risk is your network server, as opposed to laptops or as opposed to physical patient records in file cabinets. Your network server is definitely a likely target. Now, what can you do with respect to each of these common risks to try to try to prevent the breach? First, encryption is basically expected as a preventative measure. Encryption means turning the data into something that cannot be readily understood by the hacker. And the focal point of encryption is not only data that is at rest, so to speak, in the stored locations on servers, but also in transit. Secondly, firewalls are an expected prevention strategy. They help block the data breach bad actor from getting into your systems. Third is a password policy that requires passwords to be robust and changed frequently. And the best way to do that is through an automated process that keeps track of these things rather than just rely on a paper policy. Fourth, software updates. Numerous hacks are the result of companies or practices failing to apply software patches that were available even for free, the software patches having been put out to address data breach vulnerabilities. So software patches and software updates are critical to your defensive strategy. Fifth, employee training is also essential and required under HIPAA. The reason is that many data breaches or breaches of not only the privacy rule, but the security rule are the result of employees just having forgotten what they should do or how they should do it to protect your patient's data. The training should focus on a written privacy policy that your practice adopts that describes what is to be done and by whom in order to protect data privacy at your practice. You can automate employee training through several commercially available software as a service vendors so that you can have a way of tracking that they are maintaining currency in their knowledge of privacy and data security practices. The second leading cause of data breach incident is unintentional disclosure. And as I said before, employee error is the most common cause of that, and employee training is therefore the most obvious mitigation strategy. And then finally, the loss of data as a result of improper destruction of data has been the source of some highly publicized enforcement actions by Health and Human Services when documents that contain protected health information were not properly destroyed, such as by disposing of prescriptions in the dumpster out back of a pharmacy was the subject of one case. The way to avoid and mitigate that potential risk is to have a written document retention policy that describes what data and documents you keep and for what durations and how they will be safely destroyed. If a data breach incident occurs, there can be tremendous disruption to your practice, but the disruption can be minimized with some planning. First, having an excellent data backup routine will enable you to restore data rather than be held hostage to a ransomware attacker or be forced to deal with corrupted data that has been disturbed through a breach incident. Secondly, it's important to have a written, and this is required under HIPAA, to have a written incident response plan. This response plan would list exactly what you're going to do and how you're going to do it in the event that you get a call. And the value of this can be readily understood if you just visualize that each one of you, after this lunch break in which we're giving this seminar, were to go back and learn from your assistant that your system has locked up with a ransomware attack, or you've just learned that your main server has been compromised through a data breach. You're going to want to have a plan that lists who is in charge in your practice to run point on the incident response. You're going to want to have a designated team of people who are affected and necessary for the implementation of the response on the team. You're going to want to have the name and contact person of your cyber insurance company and their and appropriate lawyers and technical consultants who are on the accepted panel by that insurance company so that your out-of-pocket expenses will be covered by your insurance plan. Not just the law firm or the technical consultant, but the actual contact people so that you can pick up the phone and call them and get guidance through this incident. The first call is usually going to be to the cyber insurance company. And then finally, if you have a plan like this, it's best to have a tabletop exercise where you run what amounts to a fire drill, simulating a breach, and where you run through it as a dry run as though it were occurring in real time. That tabletop exercise can surface gaps in your plan, can refresh understanding of your team, and can mean the difference between a very awkward incident response and one that runs smoothly and efficiently and cost effectively. So in conclusion, data breaches are likely to occur. You're in an industry that is in the crosshairs of data breach bad actors. If you get hit with it, it's going to be costly, even if the studies that I've cited somehow exaggerate the cost for your particular practice. It's still going to be hundreds of dollars per record, which is a very substantial risk for any practice. But these risks are insurable, and so you should pursue cyber insurance diligently. And finally, planning and protective measures can significantly reduce both the cost of a cyber incident and the disruption that an incident has on your practice. And now I think we go to our next speaker.
Thank you so much for that presentation. So So before we move on to our next speaker, I want to do a quick poll. You should see this on your screen now. If you could just answer the question, are you looking to purchase new or modify existing cyber liability coverage? We'll just give everybody a few seconds to answer this question before moving along. Yeah, well, it looks like we've got a good mix of people on the call today, looking to purchase new, modify existing, or neither. Okay, so next up, we have Steve Rutkovitz, who's the CEO and founder of Choice Cybersecurity. Mr. Rutkovitz will discuss how practices can evaluate different types of cyber liability coverage, select the right amount of coverage, and tips for completing questionnaires required by insurance carriers. Mr. Rutkovitz works with companies nationwide to help them understand their cyber risk and implement measures to reduce the likelihood of a breach. Prior to his current role, Mr. Rutkovitz was the CEO and founder of Choice Technologies, a regional managed services provider specializing in EHR healthcare IT solutions. He develops the assess, address, and maintain process to mitigate cyber risk and prevent cyber security breaches. So I will now turn it over to Mr. Rutkovitz.
Great, thank you, Justine. I want to give you a little background on I was an MSP before Choice Cybersecurity. I had a company called Choice Technologies, and we were an MSP in the region, and we got into billing and medical billing in 2000. So we helped practices go from paper to actually to electronic medical billing way back in 2000 when HIPAA just started. Then we got into EMRs, and we started rolling out a lot of EMRs and helping practices implement their EMRs over time. And then we started seeing a lot of breaches and security problems, and we got very good at helping companies. And all of a sudden, we started getting called into a lot of security breaches around the region, and tying into cyber insurance. So we saw companies being super reactive, and just getting hit left and right. So we had to move from reactive to proactive. So today, Choice Cybersecurity is a national company, and we help companies across the country go from reactive to proactive to mitigate their risk. So talk about where the state of cybersecurity is today. So like Dave said, SMBs, 61%, it's a huge uptick of SMBs getting attacked. Then we see a 50% increase year over year of cyber attacks, and we see a lot of phishing attacks. Phishing is on the uprise, and it's really hard to stop because it keeps changing. The biggest thing we're seeing is the introduction of Internet of Things, or the IoT. And that's a category of everything gets plugged into your network from, everything that gets plugged into your network. Hold on for a second here. Everything from a machine that could possibly do like EKGs, etc. You're seeing more and more things get plugged in. We're moving more to the cloud. So the risks are just increasing and increasing, and we have to be careful. So when you look at risk, there's actually several different types of risk you want to look at. The first is your state risk. 50 of the 50 states in the country have state PII laws now. So Maryland has a state PII law, which means that if personal information or electronic medical records get breached, the Attorney General's office can fine you for these breaches. I don't know if a lot of people know that, but Maryland has a pretty strict PII law. You also have federal compliances. Well, federal compliance is HIPAA, right? So your HIPAA compliance is a federal compliance. And you know a lot about that, but that's not the only compliance you have to be concerned about. And most medical practices also take credit cards, and that's a PCI. That's an international compliance. And it's the only international compliance out there, and the credit card companies around the world have gotten together. And as you know, if there's a breach of credit card information, you can get fined. And then the last, which is the most growing of concerns, is privacy laws. 8 of the 50 states now have pretty stringent privacy laws, California being the strictest. Maryland doesn't have one yet, but Virginia just enacted one. So if you're seeing patients from Virginia, there's a pretty strict PII law. So when you look at your risk as a practice, don't just look at HIPAA, look at your total risk. It's really important to understand these different types of compliances. So I've been called in and actually worked in breaches over the last 20 years. I bet you I've been involved in 50 or more breaches. And when we get called into a breach, I can tell you, if you've had something like this, it can be pretty stressful. So you hear these crazy numbers, 1.8 million, 5 million, 10 million, you hear these numbers of, these breaches going into the millions. And people would say to me, Steve, how does this happen? How does it get so expensive? And what I thought I'd do is just take you through the anatomy of a breach and what happens. So the first thing that happens, you have an event, right? So you might see a ransomware, you try to access information and it's encrypted, you can't get to it. Little pop-up comes up and it says, you owe 4 Bitcoins. Well, in the early days, a Bitcoin was $250. Now they're $50,000. So just the ransom alone could be $50,000 to $200,000 or more. And you saw in some of these hospitals, it's in the millions. But for a small practice, I've seen it as high as $100,000 just for the ransomware to get your data back. Now you say, okay, well, I have a backup and I can restore, but a lot of these new ransomwares are actually turning the backups off, right? So it's getting more complicated. Then you have to shut down your system, right? So you have to shut everything down. Got to go to the IT support, whether it's in-house or a managed service provider. Got to shut the systems down. You start having a loss of revenue, right? Patients are still coming in. You're going to a manual system. And I've been involved watching doctors have to work with these manual systems. They don't have the charts, so they don't know the allergies, they don't know the prescriptions. It gets very complicated to practice medicine when you don't have your automation. Then you got to bring in forensics people. Forensics people can be very expensive. I haven't seen a forensics case less than $25,000. And what the forensics person has to do is they have to come in, you have to look at everything and see where the breach started, and then any data actually leaked, any medical records leak, because then you have to start the notification process. And even a small practice that I've worked with like 25 employees, in practice for 10 or 15 years could have 3,000 to 5,000 patient records. So, breach notification and being able to have the monitoring of credit for a year can be anywhere from several $100s to $1,000 per record per year. So these numbers start going into hundreds or millions of dollars. Then there's lawsuits. Well, your employees can sue you if their social security number or their HR records get out. Then you have patients that can sue you if their records get out. Then you get an attorney that might have a class action suit if lots of records get out. Then you have potential fines. So we talked about HIPAA fines could be in the millions. We talked about state fines. We talked about PCI fines. So then you have these fines. And then after that, you could have reputational long-term damage. And some of these expenses happen right away. They're called like a first party. And then it could be third party where things could actually come back to haunt you a year later. So the goal is to mitigate these risks, but I just wanted to show you what happens. And you see in the paper every day how some of these claims are so high. And I just wanted to give you kind of the insight of what happens. It's almost like a wildfire when these breaches that happen. So where is cyber insurance today? So you're seeing rising premiums. The premiums are just rising across the board. In some industries, they call it soaring. But the premiums could be anywhere from double to triple over today and over the next couple of years. And the reason is that the insurance companies are seeing a lot of uncertainty. The coverages vary from insurance company to insurance company. So we don't see any two policies that are exactly the same. So sometimes when a breach happens, it's covered. And sometimes when a breach happens, it's not covered. And you really don't know. But as we do more and more of these assessments, we're able to kind of predict up front to make sure we have the right coverage up front. I don't know if anybody has seen these questionnaires lately for cyber insurance, but they used to be like a page long. Now they're up to 6 and 8 pages long. I actually filled one out for my company this week because I wanted to do it personally. It took me about 3 hours to fill it out, 6 pages long. And it's really important to fill these forms out right, because if there is a breach or some kind of security problem, and you call the insurance company, one of the first things they do is they dust off that questionnaire, and if it's filled out wrong or improperly, guess what? They're not going to cover the claim. There's several incidences right now where insurance companies aren't paying the claims because the forms weren't filled out right. And I can tell you, some of these questions are even difficult to understand. So, you want to make sure that you call somebody in or get some help that fill these questionnaires out to make sure they're right. And the insurance companies are just saying that there's so much uncertainty out there, and insurance companies don't like uncertainty. So that's part of the problem. And the payouts are just, they're complaining about the increase of payouts across the board. So when you look at these cyber forms, I mean, I don't know if you've seen any lately, but they just, each one's a little bit different. They're difficult. You got to make sure that it's perfectly filled out correct. And if you don't know an answer, just leave it blank and let them come back to you and tell them you don't know. So after, working in the industry over 20 years, what I really realized is there's a total disconnect between cyber insurance and cyber risk of a medical practice for most businesses, right? So there's just a total disconnect, and sometimes it's right and sometimes it's wrong. And I'll give you an analogy, and I try to really think about an analogy, but as the best analogy I can think of is like homeowners insurance. So if you have homeowners or renter insurance, there's two things. There's something called dwelling, and then there's content. So the dwelling is your property. So if something were to happen to your house and let's say it burned down, then you look at how much it would cost to replace it. So an average building cost is maybe $250 a square foot. You have 2,000 square foot house. It's about a $500,000 risk. Very easy to calculate. The second question they ask you is, what is your content? So you may look around and go in each room and go, well, I got TVs and furniture, and I have clothing, and I have jewelry, and you just go around, dishes, and the list goes on, and you throw a number out of maybe $300,000. So if you had to replace all the content in your house, it'd be $300,000. Well, the problem with cyber insurance is we do a pretty good job of the dwelling piece, which is like all your PCs and servers and software. So if we had to replace everything in a breach, we could pretty much say it's, $4,000 an employee. If you have 100 employees, it's $400,000. The problem is nobody really understands the content. So the content is the data risk, right? It's the records and the sensitive data. And the problem is insurance companies have no idea, neither do companies, of what that content risk is. And the time they find out a lot of times is after the breach happens and the coverage isn't right. So what I want to help you do today is try to understand how to match and balance out the cyber risk with your cyber insurance risk. So we've developed a process. It's a 3-step process. It's called assess, address, and maintain. The first step is a risk assessment. And you want to get an independent risk assessment because a lot of times IT personnel in-house or outsourced isn't really trained in cybersecurity. While they're trained in technology, they're not always experts in cybersecurity. You want to get an independent risk assessment, and you want to get a good baseline risk assessment. Just like the first time you might see a patient, you have to spend some extra time with them to really understand and learn their history. But after you see them up for follow-up visits, you don't have to spend as much time. It's the same analogy when you're doing a risk assessment. You've got to spend a lot of time up front, really understand that base risk, and then you can measure then against that over time. Then once we understand the risk, then we can make recommendations to address the risk and bring your practice up to acceptable level of risk. And then you can put in plans to actually maintain it over time. So a risk assessment has multiple components. And like David said, you want to make sure you're scanning for the vulnerabilities. The vulnerabilities in software we're finding are really, really important because the hackers can exploit the vulnerabilities. But guess what? If you're proactive and you fix the vulnerabilities, even if ransomware or malware or something gets in the system, it can't launch. So we want to look at all your applications, whether in the cloud or local, the configurations of those applications is really important. I mean, you look at like a company like Google, they say they're secure, but guess what? They leave it up to the end user to set up the security. So if you don't set up two-factor authentication in Google yourself, it doesn't force you to do it. And we're seeing that across the board in a lot of cloud applications. Again, the policies and procedures, when something does happen, you want to make sure you have a good incident response and disaster recovery plan. It's already in place. And you got to understand your sensitive data. Without knowing your sensitive data, you really can't figure out your content, right? So we have some pretty sophisticated scanning tools that we use today that actually can go in and look at all the data at rest in motion. And here's a sample of it, just a kind of a small practice that had 35,000 medical records, been in business around 20 years. And they also have credit cards, social security numbers, and date of births. To let you know what a medical record is, a medical record is a social security number plus an IC-10 code. So if the software can see the two together, it flags it as a medical record. And then it can take the number from the Poneman Institute that calculates breach records, and it can calculate a potential breach. This is called a colossal risk. If something happened where all your data left tomorrow, you should know what that risk is. Now, we see a lot of times when we do a risk assessment, we used to just ask companies, do they have cyber insurance, and check the box. Today, we look a lot closer at the policy. And I can tell you it's very rare that I see that the amount of cyber insurance matches the risk. It's just a guessing game, right? That we can take the guessing game out and start being more strategic in how we're purchasing this insurance. So sometimes we'll see a $10 million risk and we'll see $1 million in liability insurance, and sometimes vice versa. We won't see a lot of risk, but we'll see a higher amount. Okay. So in addition, you want to keep the HIPAA risk compliance intact. And remember, the risk assessment by HIPAA has to be done on an annual basis. The insurance companies are also asking for the risk assessment on an annual basis. There's so many changes that happen on a yearly basis. You really want to make sure you have these risk assessments in place, and we can help you kind of keep it up to date. Now, there's a little law or rule that both state PII laws and also HIPAA has that you may or may not know about, but it's a kind of a secret. But when I tell people about it, they're like, wow, this is great. I want to know more about it. And it's called a safe harbor rule. Safe harbor, like what David touched on, is safe harbor. If your data is encrypted, right? Your sensitive data is encrypted in the medical records, and sensitive data is encrypted, you fall under a safe harbor. If you fall under a safe harbor, you don't have to notify, which is very expensive, and you can't get fined for a breach. Okay, so that really just crushes your risk right off the bat. So just like before, when I was showing you the anatomy of a breach, if we can proactively go in and do the risk assessment and then protect that data, either clean it up or encrypt it, but then reduce that risk and encrypt and fall under a safe harbor, you still have the event, right? You might have to shut down temporarily, loss of revenue, but you may not have to bring the forensics guys in, the attorneys, the breaches, the lawsuits. You can kind of stop these breaches right in their tracks, and then you don't have to notify, and then you can't get fined for a breach. So what we've done is taken these breaches that have potential like wildfire costs of going up over $1 million, and the average breach, if we get involved in, and it's already encryption and a safe harbor in place, I've never seen them go higher than $100,000. A lot of times it's a lot less. That $100,000 is with forensics. So it's really a game changer. And we've kind of done over 100 risk assessments in the last 24 months. And we're doing more and more safe harbor and on most of these assessments. So, I promised to help you understand how to buy cyber insurance. So the first thing is you want to know the amount of coverage. Right now, that amount of coverage is really in the insurance carrier's guess. And, sometimes it's over coverage, sometimes it's under coverage, but they really don't have the information to do it. With the right risk assessment, you're now armed to be able to have kind of a collaborative conversation with the insurance agent and say, look, maybe I don't need as much covered. I got, data encrypted. We have two-factor authentication. We have these things in place. Maybe we don't need as much coverage. And now it's kind of a collaborative conversation, and you're a lot smarter when you actually go to get this coverage. The coverage terms. When we do the risk assessment, we can tell you what the most common risks are. Most common risks are, believe it or not, is your ransomware, is brute force attacks, meaning that somebody breaks into one of your passwords or through the firewall. And I've seen it several times, insider, right? I've seen people that have sabotaged systems, and I've also seen IT vendors that were outsourced that, somebody in that organization got upset and they came back and sabotaged systems. So the three big things you have. So if something like that happened, you want to know up front that your coverage is in place and it's not a surprise down the road, right? Premiums, you want to shop at least 3 companies. Just like we talk about homeowners, you can really get an apples and apples price, but within cyber, you really can't. So I would say, 3 minimum. You can try to get 4 or 5 prices, but at least 3 prices so you can compare the premiums against the actual coverage. The deductibles are all over the board. This is kind of something that I found. So it might say it's a $2,500 deductible, but on ransomware, it's a $50,000 deductible. So we were caught into a case. Somebody showed me their insurance policy, $50,000 deductible. I said, you might as well self-insure. This is a really high number, right? That's why I'm buying insurance. So you want to look at the deductibles on every type of claim that happens. And then you got these exclusions and caps, right? So now the insurance companies are excluding a lot of things that they weren't excluding in the past. And they call them trap doors, right? So you think you got something and boom, you fall into a trap door. And I'm also seeing a lot of caps on actually fines and also on the ransomware payouts. So if you have a cap of $25,000, I can tell you it's a half a Bitcoin. It's really not going to take you very far. So you got to be very careful when you're purchasing insurance. So in summary, a risk assessment, can't emphasize it enough. It's a baseline risk assessment, and you need an independent risk assessment. You really need somebody from the outside to make sure that you have the right security in place, know your risks, and it also helps as a check and balance against your IT personnel that's actually managing your system right now. You want to go and right size your insurance coverage. Now that you have the right information, you'll be a better, more informed buyer of this insurance, and you can decide what risks you want to take and what risks you don't want to take. And remember that safe harbor, especially for state PII and also for HIPAA, goes a long way in minimizing your potential risk. And if you're 50 employees or less in the state of Maryland, there is actually a state tax program. It's the only program in the country, and it's like free money, because if you are 50 employees or less, you're buying cybersecurity services, whether it's risk assessment, firewalls, whatever you're buying, and it's from an approved vendor. We're actually one of the few approved vendors in the state of Maryland. It's a 50% dollar for dollar tax credit. So if you're paying Maryland state taxes, and let's say you pay $20,000 in taxes a year, you spend $10,000 in cybersecurity services, you would get 50% or $5,000 off your taxes. You'd be paying 15 instead of 20. And we've helped, dozens and dozens of companies work through this program with success. And in 2022, there's several $1 million available for tax credits. So just want to let you know that as well. And with that, I want to thank you for your time today and turn it back over to Justine.
Thank you so much for that presentation. It was very informative. Let me just reshare my screen. You all can see that? Okay, so this concludes all of our presentations, and we're now going to open it up for Q&A. You can type your question in the chat box and I'll read them aloud, or you can use the raise hand function, which you'll find in the reactions at the bottom of your screen, and I can call on you to unmute yourself and ask your question. If we do not get to your question, someone will follow up with you after the meeting. So while everybody's kind of gathering their questions, I see we have Dr. Bevell, who's an ophthalmologist, attending today. I'd like to welcome her to just share some remarks on ways that her practice approaches cybersecurity and why cyber liability insurance is a part of that approach. So Dr. Bevell, if you're able to unmute.
Yes. Hi, Justine. This was a fantastic presentation, both by Arthur Kerman from the lawyer perspective and also from Choice Cybersecurity, talking about the more technical side. I'm an ophthalmologist, solo practitioner here in Maryland. I also have a master's degree in cybersecurity as well. And I also have cyber insurance, even though I do have some understanding of this. And I think it's especially important for people to know that some of our malpractice coverage may include cyber insurance, but as Mr. Ruckowitz mentioned, it may not be enough when compared to the amount of risk that you incur from a data breach. So they usually give you a base amount, maybe like $50,000. And as we heard, with $430 to $500 per record, that clearly isn't enough. So you should get a separate policy. And you have to remember the threat actors take advantage of every opportunity. So when we were all down with COVID, everything ramped up with cyber attacks because they saw it as an opportunity. And just to tie in with what's going on today, now today we're having this destabilization with the Ukraine and Russia. We know now that cyber warfare is maybe a preferred method of attack. So if cyber warfare is going on, it's not going to just stay in the Ukraine or whatever it is. All the computers are connected all over. So probably with what's going on, we're probably going to see even a more increased threat from cyber attacks. So I just want people to realize, even though you may have cyber insurance from your malpractice insurance company, that may not be enough. And just one other statistic, in 2021, the average cost of a data breach in healthcare was 9.23 million. So the attorney was right on when he said about $1 million. And if you want to get an idea of who's being attacked, you can go to, they call it, the colloquial name is the HHS, Health and Human Services Wall of Shame. You just put that in there and you'll see everybody in there from Walmart to solo practitioners who've been attacked. Looks like there are a lot of questions, so I'm gonna let people get their questions answered.
Great, thank you so much. So we do have a few questions here. I'm just gonna start reading to them. Like I said, if we don't get to your question or it wasn't answered, we'll definitely follow up with you after this. So the first question is, my business policy is through MedCai. Does the business policy through MedCai include the cyber liability insurance?
I can take that.
Sure.
That's just exactly what I was talking about. There is a level of cyber insurance, but it's probably not enough. And going through a broker or MedCai does have a separate cyber security policy. You can compare and see. It's sort of like when you have disability insurance, and you may have disability insurance up to a certain level, but that may not cover you for your whole salary if you're disabled.
Thank you. So looks like our next question from Ms. Gross got answered. So I'm going to skip to the next one. Should medical offices only use the patient portal to receive forms, et cetera, or is clicking on an email attachment on Outlook not as risky as it sounds?
I think, Steve, you'd be good to weigh in on this, but I think that the portal is a more reliable and secure way to receive data. If you or clicking on an attachment, then the question is the attachment encrypted? Second is this a phishing issue, is this a phishing attack? But if it's even from a known patient, receiving it unencrypted is in an email attachment is not as good as receiving it through the portal where presumably it will be encrypted in motion, in transit.
Yeah, I would touch on that. So the portal is going to be more secure, but you got to be very, very careful in these attachments. A lot of what these phishing attacks look like is one letter is changed on like the domain, right? So I'm choicecybersecurity.com. I could register choicecybersecurity1.com, and you're busy and you're just clicking on things. You have to be super careful what you're clicking on. So first look to see if you even know the person, and second, make sure that the extension is like a .doc or whatever. Be careful of like a rogue extension name. But I'd be very careful on attachments right now.
Great, thank you. So it looks like there was just a little bit of conversation here. If anybody else has questions that I missed, you can raise your hand. Otherwise, we'll just start to wrap up here.
One other thing I did want to mention, I see in the chat people are talking about how expensive it is, but as physicians, we also have to remember we have our patients' health at stake here. And getting the cyber security risk assessment is really important. Studies have shown that hospitals that have had a data breach have increased mortality from heart attacks than hospitals that have not. And you can think of why that might be. With heart attacks, we want to look at the EKG, and we may want to compare it to a prior EKG. And if you've had a data breach and that prior information is unavailable, you may not be able to see what changes. You don't have anything to compare it to see what changes are going on. So it's not just the money that we're worried about, it's also patients' health.
You could make similar comments about health insurance. If we all pay individually, unbelievable amounts of money, particularly as you get older, for health insurance. So is it worth it, or should we be self-insured? Well, you have one serious procedure, could be a disaster for a family's income situation. Likewise, a practice that you've spent decades building up can be, destroyed in a single incident. The cost of the insurance may be a little bit higher than you would like, but you should look into it. But how does that compare to what's going to happen if the incident, you have an incident that's uninsured? Good to take the precautions that Steve mentioned in focusing on safe harbor encryption as well, because that's going to help to mitigate your potential losses.
And these encryption software programs are very inexpensive now. So, we try to find super practical tools because most of our clients are kind of small to medium. So we don't do the big hospitals, we do most of the medical practices, and you have to be very conscious of budgets as well. So there's things you can put in place, but you really have to understand the risk in order to figure out what to put in place. And at the end of the day, you're going to be able to bring that insurance premium way down.
Just as a caveat on encryption, in order to be under the safe harbor rule, the encryption method and protocol has to comply with the standards published by the National Institute of Standards and Technology, or NIST. If the encryption, in place and in transit doesn't meet that standard, then you're not under the safe harbor rule. So you have to be careful about that.
Great, thank you all so much. Really appreciate it. So we're right up on time. So I'm just going to make some closing remarks and we'll be good for the rest of the afternoon. So here are just some resources. This will be available in the slides. We will post them online for anybody who's interested in a bit more information. And again, I want to thank everyone for attending. Thank you so much to our speakers, Mr. Grieber, Mr. Rutkovitz, and Dr. Bubel for your input. It was wonderful and very informative. And thank you, MedChi, for co-sponsoring the webinar. Again, as a reminder, I'm going to be sending out the survey via SurveyMonkey to get your feedback on the event. And you must complete this in order to be awarded the CME credit And as I mentioned, I will post the recording and the slides available on our website in a few days, and I'll send a follow-up information early next week with that information. If you have any additional questions, just please do not hesitate to contact me, and have a great rest of your afternoon, everyone.